Alaikum, everyone. Thank you for being here. Thank you for joining us. My name is Ahmed Idris. I am the program coordinator for Wellshare International. Thank you for joining us on this evening for our conversation around Ramadan and the COVID-19 vaccine. Inshallah, we have two very, very good speakers joining us this evening. And inshallah, I'll introduce them a little later. But first, I will begin with a brief presentation, inshallah, on the organizations involved in putting together this Facebook Live, this discussion. So inshallah, let me share my screen here. All right, Bismillah. So I know, so as you can see, inshallah, this is our Ramadan and COVID-19 vaccination live Q&A. So you'll have the opportunity to ask questions to our speaker, our main speaker, Dr. Hatem al-Hajj, and this will be, inshallah, hosted by our brother Jaylani Hussein. So just going into the organizations involved, this program is being presented by Wellshare International. Wellshare is a nonprofit health organization that works with immigrant and refugee families to help them live healthier lives. And they work on health equity using the community health worker model. So community health workers, if you don't know, are certified community health workers that are from the communities they serve. So they represents the communities they served, and they're trusted by the communities that they live with to relay health information. So inshallah, one of the projects that Wellshare has is the COVID-19 response project, and this is one of our current efforts is to vaccinate all Minnesotans who are eligible to receive the vaccine. As you know, Tuesday, March 30th, every Minnesotan age 16 plus is eligible to get their vaccine shot. And so, of course, with that comes questions about how people can get vaccinated, about questions regarding, of course, as we're approaching Ramadan very soon, Allahumma balighna Ramadan, we have questions that our community has had about taking the vaccine in Ramadan. So this slide shows some of the upcoming vaccine opportunities. So Wellshare itself has a partnership with Walmart Pharmacy in St. Paul to vaccinate people of color. If you are interested in getting the vaccine, that event is on April 24th, and we have our hotline here if you would like to register. And of course, we have it in Somali, Oromo, and Spanish. Another effort to vaccinate the Muslim community has been with the Muslim American Society. They have launched a Ramadan vaccine campaign, working with masajid in the community. So inshallah, there's some information there. There's a link here in the presentation, but I'll also add the link to the chat. So if you haven't signed up for an appointment, this is one way you can do that. And over on the right there, there's a Darul Uloom Islamic Center. There's a pop-up vaccination clinic. That's actually occurring tomorrow. So if you are hoping to get in vaccine, there is some more information about how to get the vaccine, inshallah, through them. Another effort that Wellshare is involved in is with the Minnesota State Fairgrounds. You may have seen this in the news, but the Minnesota State Fairgrounds will be vaccinating community members. This will be a mass vaccination effort at 3,000 vaccinations a day for 8 weeks. And the way to register through that is through the vaccine connector, the Minnesota Vaccine Connector. Inshallah, and this is for a by appointment only for 16 and up, living in select zip codes in Ramsey and Hennepin County. Right, so this is just an example of the vaccine connector itself. Some of you have already signed up on there, and this is one main tool that our state has been using to vaccinate community members. So another partner in this Facebook Live who helped us put this event together is, of course, Building Blocks of Islam. This is Building Blocks is an organization that is very dear to the Minnesota Muslim community. They I grew up on building blocks through their youth programming, and of course, we all know about their community service efforts. So one of the, of course, emergency assistance program, their homeless project, their food shelf, and their COVID senior response project, so delivering basic needs to seniors, inshallah. So if you are interested in getting involved in any of these efforts, or if you would like to learn more about them, there is their email, info@thebuildingblocks.org. And one of the highlights of their one program that they want to highlight is the Give 19. So just $19 can go a long way in providing someone with food, with paying bills, whether that be their utility bills or phone bills. As you can see by the graphic, this is an effort to support families who are affected by COVID. And then last but not least, so we have our CAIR Minnesota, which is another partner organization that we are working with to deliver this education session. CAIR Minnesota, mashallah, has been doing a lot of work in our community, not just advocating for Muslims, but really advocating for justice for everyone in the state and beyond. And inshallah, of course, they've been doing work. A lot of their recent work has been around educating the community around the Derek Chauvin trial, and how that, and really, fighting for justice for George Floyd. We really thank them for partnering with us to deliver some COVID-19 education for our community members. These are some of their upcoming events. So there is some upcoming, they have their week summary of the Derek Chauvin trial. This trial has been every day. We learn new things about it, and they are, summarizing that every week. There are also some of their upcoming rallies and other events here. So Justice for Justin and All Stolen Lives by Police. Another event CAIR is organizing is their virtual fundraisers upcoming April 30th. That's going to be at 5:30 p.m. and that will be live streamed. So tune in for that, inshallah, when that time comes, inshallah. Okay, with that, thank you very much. Now we're ready for our programming. So we will be, I'm very excited to be listening in on this session and benefiting from Dr. Hatem Al-Hajj. Just a brief bio of him. He is an Islamic scholar, a board-certified pediatrician, and a member of the Fatwa Committee of the American Muslim Jurists of America. So we are very, very privileged and honored to have him with us today, as well as our dear brother Jaylani Hussein, who is our executive director of CAIR-MN, and of course, leader. So with that, inshallah, I will take the screen down, and Jaylani, you can take it away.
Thanks, Ahmed. Thank you for putting this event together. We appreciate Wellshare and Building Blocks for really putting the event together in a timely manner. Of course, our teacher and scholar and most respected leader, Dr. Hatem, to have give us this time to really bring awareness to the community about some really important questions about the vaccine and also the month of Ramadan. So really appreciate that. I know you're traveling and it's a difficult request, but really appreciate you honoring that. So without further ado, again, I really appreciate Ahmed for putting this together. And for everyone who's watching, feel free, if you have questions as we keep the conversation going, you can put those questions into the chat, and hopefully we'll get through that. We will start off with some just questions, general questions, and I guess we're still in the pandemic. We're still dealing with the unfortunate reality of this COVID pandemic. So last Ramadan, Imam, it was very difficult and challenging for everyone, and the way we observed Ramadan. And so I guess this year with the vaccine, obviously some hope about controlling this pandemic. What are your general thoughts and kind of around what Muslims should be doing, particularly around Taraweeh in the month of Ramadan and gathering at the masjid? Is there any general advice, recommendations, or thoughts that come into your mind at this moment?
Bismillah, alhamdulillah, sallallahu alayhi wa sallam, I'm about to proceed. Jazakumullah khair for the invitation. Jazakumullah khair also for putting this together and your tireless work for the community. I would say that this year, inshallah, most masajid will have Taraweeh in Ramadan. I think the burden of COVID-19 may be a little bit lighter this year because by the beginning of Ramadan, a good number will have been vaccinated, but nowhere near herd immunity to put our guards down. So it's important to remember that herd immunity is when about 70% of the population had been vaccinated, and we're pretty far from this. Therefore, we will have to continue to exercise caution and to practice the measures, the COVID-19 safe measures that we've been practicing, such as social distancing and wearing masks and things of that nature. And I think that it would be unfortunate when we are very close to herd immunity, basically to lose members of the community. And we have lost members of each community throughout the last, how many months now, 14, 15, 16 months since this started. So we're close to that sort of milestone, and inshallah I'll try to just stay patient for a couple more months until we get to that point where it becomes safer and the prevalence of the virus is diminished. So this Ramadan, just follow the guidelines and follow the instructions and good counsel of your local masajid, and hopefully, inshallah, the local masajid will in turn follow the good counsel of the scholars of the deen and the public health professionals, the experts in public health. It's just like a joint, most of these decisions are joint decisions because they entail two parts: the benefit-risk ratio, which can be best calculated by the public health professionals, and then the Shara'i perspective, which is the prerogative of the shuyukh.
That's a important reminder about the herd immunity and just the fact that we just started of really vaccinating people. So, and we're not at that threshold yet. I know Minnesota has been one of the better states with vaccinations, but so, you know, I think last year was a reminder that we can still you know, we can still do our ibadat, particularly in the month of Ramadan, at home as well. So, you know, for folks to just follow those guidelines is absolutely critical. And I know right now with Jum'ah, some masajids are still, you know, doing that fully. Some masajids are not. And remembering what that is. And I know Minnesota will have reduced some of the laws when it comes to the occupancy of how many people can be. But I know that all the masajids are still requiring everyone to social distance and also have face masks, regardless of whether they've been vaccinated or not, to protect folks. What about elderly? Are elders who are more prone to the severe effects of this pandemic who have not been vaccinated? Should there be an extra, I guess, attention to them to make sure that if they're coming, that people should help them get vaccinated, obviously, to make sure that they can, if they want to participate in Taraweeh or other functions?
I think you need to be vaccinated and to have been vaccinated for a couple of weeks to have a good level of immunity. So it would be too late now to sort of start a campaign. I mean, we should always be advising our elders to get the vaccines, because that would help, whether it's for Ramadan or not for Ramadan. But for this particular Ramadan, if they had not gotten the vaccines yet, I'm not quite sure that it is going to make. Maybe if you get like 2 shots quickly, or 1 shot, the Johnson & Johnson or something, you can catch some of the Ramadan in catch some of the congregational ibadat in Ramadan. But for the high-risk groups, I think that it would be safer for them not to participate. And if they were to participate, they should really participate in masajid that are pretty cognizant of the risk and strict with enforcing the guidelines.
Absolutely, absolutely. And then you mentioned the Johnson & Johnson. What about, I know some people are talking about some of the components of that, including tissue that's in the vaccine, or the way that the vaccine has been created. What is I guess, the general permissibility of these vaccines, or halal as a perspective?
Yeah, so the vaccines basically are cultivated in fetal, like lines of fetal cells that were harvested from aborted fetuses in the 1970s. So keep in mind that there are a few things that we want to keep in mind here. One thing is, no one, Muslim or non-Muslim, and with any conscience, would allow aborting fetuses for the vaccine or for the research or anything of that nature. And none of this is happening. So that has to be first stated. Second, those aborted fetuses may have been aborted spontaneously, or maybe have had been aborted for sort of a valid indication. Third, these are cells that have been basically produced from those original cells, have been multiplied from those original cells. They're not those original cells themselves. And given all the above, there will be a little bit of controversy, because even in our madhahib, the Hanafis and Malikis are a little bit stricter when it comes to using human body for different purposes. Hanafis and Malikis would not allow a person that is dying to eat the flesh of a dead person, just keep in mind that we're talking here about a person who's dying in the middle of the desert, and that person found someone dead. Are they allowed to eat the flesh of the dead person? The Hanafis and Malikis would still say no. That, the trickle down from that position on organ transplantation and on the use of parts of the human body, even from cadavers or from dead bodies. We have the trickle down of that disagreement, that traditional early disagreement. But I know many great Hanafi scholars who allow organ transplantation because of the necessities in our times, and because medical treatment and medical intervention in our time is not really based on conjecture like it used to be 1,000 years ago. It's completely different. Insulin helps diabetics. We are certain that it does. If you don't take insulin and you have diabetes, the chances are you will die. Based on human calculations, you die. And, and so someone who does not take insulin, someone who's diabetic, like a type 1 diabetic, who refuses to take insulin, that person is actually killing themselves. That is يلقون بأيديهم إلى التهلكة if they don't do that. So medical interventions are different now, so the scholars are more lenient. Finally, I want to say that you know, the Hanafis and the Shafi'is, they are lenient with using unwholesome substances for the purpose of medical intervention if there are no alternatives, and we know that the substance works, that the substance is efficacious in treatment of particular diseases. So that also has to be remembered. Given all the above, the vast majority of Muslim scholars would allow, it's not a consensus, but the vast majority of Muslim scholars would allow the Johnson & Johnson in addition to the rest of the vaccines. Now, as a Muslim individual, maybe the Johnson & Johnson, because of those fetal cells, there would be some Muslim scholars that would have reservations. And if you want the so-called, to invoke the concept of al-wara and al-khuruj min al-khilaf, you know, to pious caution, to exercise caution by just avoidance of controversy in general, and you have the option of taking one of the two others, Pfizer or Moderna, go ahead. The technology of Pfizer and Moderna does not involve the use of any fetal tissues or anything of that nature. But if Johnson & Johnson is the one that is available to you, then I plead to you to take it because it will help you, and the vast majority of Muslim scholars would still consider it permissible.
That's very helpful, and thank you for explaining that. And for those who are watching, we are talking about vaccines and Ramadan. And if you have questions, you can feel free to put them in the chat. We are here with Dr. Hatem and Hajj. So I guess, Sheikh Hatem, I guess getting into Ramadan now, can you kind of maybe cover, first of all, the idea of being vaccinated in Ramadan while fasting, and then some of the challenges one involves where someone may develop some symptoms from the vaccine as well. In general, some of the basic reminders around the rules of fasting.
Okay. You know, when it comes to the vaccine in Ramadan and taking the vaccine in Ramadan, I just have to tell you one principle that we can use. Actually, the person who stated this in a very succinct manner is Alauddin Kasani, a great Hanafi scholar. He said that things that would invalidate the fast are the things that are like the things that we know from the revelation would invalidate the fast in one of two ways, in form or substance, في المعنى or المبنى. كالمفطرات في المعنى أو المبنى. They are like those invalidators that we know from the revelation in form or substance. In form is when you eat paper or when you swallow rocks. In substance, that is not like eating because there's no nutrition, there is no hydration. So it's only in form because you are swallowing, you are taking something by mouth and swallowing them. Even if they're rocks, they would invalidate your fasting. In substance, that is what we say about IV hydration, IV nutrition. If I give you glucose in the IV to keep you from getting hungry or to keep you energetic, that, according to the majority, that's not even a consensus also, but according to the majority of Muslim scholars, that would invalidate your fasting because it is like the invalidators in substance, in meaning. The same applies to IV fluids for hydration. So what about the vaccine? Is it like eating and drinking in form? No, this is completely different from swallowing. Is it like eating or drinking in substance, in meaning, in purpose? No, because that gives you no nutrition, gives you no hydration. whatsoever. Therefore, again, the vast majority of Muslim scholars would consider this to not invalidate your fasting, and this is the position of the International Islamic Fiqh Academy, which is the largest fiqh assembly in the Muslim world. So that's the first part of the question. Now, the second part of the question about, people who may get vaccinated and then end up feeling sick, they're fasting, what should they do? Can they break their fasting? Of course, if you become sick, then you have the rukhsa. Because فَمَنْ كَانَ مِنْكُمْ مَرِيضًا أَوْ عَلَى سَفَرٍ, Allah subhanahu wa ta'ala exempts those who are sick or traveling. So you have the rukhsa, you have the concession to break your fasting. You say to yourself, well, why should I take the vaccine in this case? Well, where you're taking, if you're able to take the vaccine before Ramadan, well before Ramadan, do it. But if you're not able to take the vaccine until Ramadan, then don't defer taking the vaccine, because you will basically, God forbid, you may contract the disease before you get to it. So take it whenever you can get the vaccine. Just get it, even if it is in Ramadan, and to protect yourself from the disease. And then, if you become sick, then you have the concession to break your fast and to make up later. Just make up later by fasting one day for each day that you broke the fasting. Just as simple as that. And try to do this before the next Ramadan. Otherwise, then some of the mazahib may require the makeup and the kafara, or expiation by feeding. But inshallah, you'll have plenty of time to make it up before next Ramadan.
Inshallah. So Imam, speaking of that, taking the vaccine in Ramadan, and does it reduce the effectiveness if your body is not, not as strong because you're fasting? Is there any concern about that?
Well, I don't think that research has been done on this, but it is also not expected to reduce the effectiveness of the vaccine. Ramadan does not devastate your body to that extent that it will not be able to mount an immune response to the vaccine. Actually, Ramadan, it is said that fasting may, in fact, boost the immunity of the body. So, yeah.
And for those who do get sick in Ramadan, I know there's still people who don't want to make up the fast, but the rukhsa is there, as you mentioned. For those who do get COVID or symptoms, I mean, the advice is to break their fast so that they can recover faster and at least make up the rest of their month. Can you stress on that? Because I know sometimes people, I don't know whether it was especially with this pandemic, that if they start to get sick, to immediately obviously get tested, but also make sure that they are fighting this disease and are not using Ramadan as an excuse, because Allah subhanahu wa ta'ala clearly not only gives the rukhsa, but also very clearly makes that point clear.
Yeah, so if you get sick, the idea here is, what is better for a sick person? What is better for a traveler, even for for the traveler, let alone the sick person? Some of the scholars said, because there is a concession, it is better for the traveler to break the fast. And there is even a hadith from the Prophet ﷺ, لَيْسَ مِنَ الْبِرِّ الصَّوْمُ فِي السَّفَرِ. It's not part of righteousness to fast while driving. Why? Because it makes you weaker, and when you're traveling, you want all the energy you need for the travel, for the hardship of travel. But there are those positions that reconcile and say that for those people who will not feel weakened by their fasting, then it may be better for them to fast while traveling, or at least equally good. And for those people who will get weakened by their fasting, then it is better for them for sure. And this is the advice of the Prophet ﷺ, where he said it's not righteousness to fast while you're traveling. So advice of the Prophet, if it causes you to become weak, then it is not righteous. Just like takalluf, like excessive legalism, over technicality, are not isn't necessarily indicative of the right type of spirituality. So I wouldn't be mutakallif. The Prophet ﷺ, Allah said to him to say, وَمَا أَنَا مِنَ الْمُتَكَلِّفِينَ. I'm not of those who are hyper-technical, overly legalistic. If the fast will weaken you, will not allow you to recover promptly, then fasting would not be the better option here. It would actually be khilaf al-awla, or suboptimal.
Jazakallah khair for that, and if your audience are watching and you still have questions, I think Dr. Hatem, you're very thorough in answering at least these big questions that people, some people just need a really strong reminder, and so I'll bring Ahmed back to if there are any additional questions from the audience that we can take. I guess Sheikh Hatem, maybe just a general another reminder of some of the bigger ones, the bigger reasons what can break the fast in the month of Ramadan that people should be mindful of. I know drinking water and as you mentioned, the substance in the form, but also sometimes people forget that we're also fasting from the sins as well, and being mindful about all of those things. So can you maybe just give us a short reminder about taking the best of this month and actually adhering to all of the basic understandings of what we need to stay in line with when it comes to fasting in the month of Ramadan?
Well, some scholars like Ibn Hazm, they went as far as saying that these things actually break your fast. But the majority did not say that, and the majority are correct here. They don't break your fast, but they ruin they ruin the benefit, they ruin the spirituality, or they ruin the spiritual gain, the spiritual development. They hinder the intended spiritual development in the month of Ramadan. That's why the Prophet ﷺ said, "Man lam yada' qawla az-zur wal 'amala bihi falaysa lillahi haja an yada'a ta'amahu wa sharaba." Fi an yada'a ta'amahu wa sharaba. So he who does not abandon or forsake or abandon or cease speaking falsehood and doing evil, Allah does not need him to forego his food and drink, or to abandon his food and drink. And it is, if Allah wants you to avoid things that are inherently permissible, to show your commitment and devotion to Him, and to train yourself to avoid the muharramat, then it's very self-defeating to be doing the muharramat and avoiding the mubahat in Ramadan. You are being told to avoid the mubahat, to train yourself so that you would avoid the muharramat.
Yeah, and it's sometimes it's a little bit easier when you don't have the energy to to get involved in those things. But that's a really good reminder for all of us. This Ramadan is always one of those things that that can have a major impact. This year was just a challenging year, I think, for all of us everywhere we were. From last Ramadan to this Ramadan, especially here in Minnesota and all over the world, this pandemic and all of the other issues that have been happening have been very difficult on all of us, on our spiritual heart. And so I think many of us are really excited about this month, and we want to just take as much out of it and rejuvenate and rebuild and reach, to hopefully gain taqwa, as Allah subhanahu wa ta'ala reminds us of this important goal for the month of Ramadan. I guess before we ask, I have a question that came in about the new variants and some of the different changing of the pandemic. But can you kind of, I guess, maybe just give us a point of nasiha about, we feel the sense of weight and challenge of all of the different issues that have been happening, all of the crises in the world, and here, even in Minnesota now, we are, become the center of, a civil rights movement to hold police accountable against brutality, which happens everywhere in the world. But unfortunately, in America, the mirror is always facing the rest of the country, the rest of the world. They're always seeing problems everywhere else except here. So as we kind of enter this month of Ramadan with the pandemic on our back, with all of the other challenges, I guess, what is your general nasiha for all of us and those who are watching? How can we prepare and get ready for Ramadan and take the most out of it?
The nasiha is basically to not be to not lose hope, to have raja in Allah subhanahu wa ta'ala, and to have hope in Allah subhanahu wa ta'ala. عجبا لأمر المؤمن إن أمره كله خير إن أصابته ضراء صبر فكان خيرا له وإن أصابته ضراء شكر فكان خيرا له وليس ذلك لأحد إلا للمؤمن. So the Prophet ﷺ said that how amazing the affair of the believer is. Everything is good for the believer. If he is afflicted by hardship and he becomes patient, that would be good for him. And if he's blessed by bounties and favors or ease, and he shows gratitude, that will be good for him. And that's not for anyone except a believer. That's why the Prophet ﷺ used to be the epitome of optimism. And he used to basically radiate, transfuse the environment around him with optimism and encourage his Sahaba to be optimistic. After all, we have we have a potential in goodness, in virtue, in devotion to Allah subhanahu wa ta'ala to actualize while we are here on earth in this life. And as long as we are working to actualize that potential, whatever happens and however we actualize that potential, through patience or gratitude, we are actualizing it. And it's only it is short. That does not mean it's not. When we say this, it's not to be morbid or anything, but it is to put things in perspective and enjoy it in a wholesome way, because it is short. But keep your eye at the sort of afterlife, because it is the everlasting one, and work hard for the everlasting one, and never lose hope. Put your trust in Allah subhanahu wa ta'ala. He's most compassionate. He reserved 90, like he divided mercy into 100 parts or shares, and he reserved 99 for himself. And that is just to basically make the parable easier for us to understand. Otherwise, you can't compare Allah's mercy to our mercy. When the Prophet says that 1 part of 100 parts were given to all creatures, you know, the horse keeps her foot off of her baby horse out of mercy with that 1 part. So you can imagine the number of species that exist and the members in each species. We're talking about billions of creatures, you know, over time, and those billions, you know, trillions of creations over time, all the mercy they have collectively, and a lot of people have huge, basically, springs of mercy inside them, and all of this is 1 part combined, and Allah reserved 99 for him. So your Lord is most merciful, your Lord is just, and your Lord is also powerful. So don't despair, don't lose hope. Everything that is happening in this world is under his control, and no one can overwhelm him, and no one can frustrate his will or his power. He's all powerful, and he's testing all of us. Just make sure that you perform well on your test, and do this consistently until you meet him, and then you will be you will rejoice endlessly when you do. That's it. It's pretty easy for a believer.
No, Jazakallah khairan. That was very beautiful and well said. And we have to have that optimism and hope. And it's interesting, subhanAllah, Imam, you mentioned this. You know, last Ramadan, as difficult as the Ramadan was, so many unique things happened. So many wonderful things happened. For the first time, many of us had to pray our own Taraweeh at home. We reconnected with our family in unique ways. It was a different Ramadan, but it had uniqueness that we couldn't see, even in the not used to certain things that we were hoping for. I remember even in Minnesota, for the first time, you know, we made the call to adhan in the city of Minneapolis publicly, and now the rest of the country or other parts of the world started to do that, and it opened the conversation about, you know, doing this, and we're hoping to do that again this year, and even hopefully in the future for more permanent. But you know, so even in these difficult moments, there's so many wonderful things that come up that sometimes it's hard for us to see at the moment. So yes, that's a really wonderful reminder. As a follow-up, our favorite brother is watching with us. Jazakallah khairan, Brother Mashoud. He's put a couple of questions, and as a follow-up to your point, Sheikh, what is a good, I guess, a dua that you recommend that during the month of Ramadan for folks to, I guess, deal with all of the issues, but also just being mindful of being optimistic and to remove, as he says it here, this idea of waba in our time?
Well, you know, قلت استغفروا ربكم إنه كان غفارا يرسل السماء عليكم مدرارا ويمددكم بأموال وبنين ويجعل لكم جنات ويجعل لكم أنهارا. Istighfar is extremely important, and it opens the doors for bounties and favors from Allah subhanahu wa ta'ala, and prosperity and wellness. And the dua that the Prophet ﷺ taught Aisha radiallahu anha to make in Ramadan relates to this, because it's about asking Allah for his af. Allahumma innaka afuun tuhibbul afwa fa'fu anni. So, oh Allah, you are forgiving and you like forgiveness, so forgive me. Allahumma innaka afuun tuhibbul afwa fa'fu anni. I think that we ask Allah, we should make istighfar, and we should ask Allah subhanahu wa ta'ala for his af. And if we earn that this Ramadan, then certainly most of the burden on our shoulders will be removed.
No, Jazakallah khairan for that. And you know, that is a very powerful dua in the month of Ramadan, and especially seeking Laylatul Qadr. We did just get a question. I'll pull it up about the vaccine. I think someone maybe. Assalamu alaikum. I have a question regarding the vaccine. There are a couple of them. Is it safe for all, or some may not be sure and safe? So the safeness of the vaccines, I think we talked about it a little bit at the earlier. But Imam, can you maybe just give us a general reminder? So the question is more about the safeness of the vaccines, and are they all safe? Or?
Safety of the vaccines?
Yes.
They're asking about the safety of the vaccine.
Yep.
You know, this will always be a controversial issue. We had the studies that had been done, but we also have real-world data that are abundant now because millions of people have taken the vaccine. And so far, you know, the idea that this is a conspiracy is just like a very lame idea. You know, if you think about it, who's conspiring against who here? I mean, if the medical if the healthcare is professionals, or the medical profession is conspiring against the world, they would not be taking the vaccine first. You know, they would just make sure that it'd be the last to take it, so that they finish it off everybody else, and then they'll be there to enjoy, you know, no traffic and stuff, because everybody would have died. So these ideas are really not, you know, they're too far-fetched that should not be entertained. The vaccine may or may not be safe long-term, but benefit-risk ratio is not calculated by lay people. Benefit-risk ratio, when it comes to medicine, is not calculated by the shuyukh either. Yeah, this is not a shuyukh issue. You know, that is why the Prophet ﷺ said, "Antum a'lam bi umuri dunyakum," you know the affairs of your dunya better. So that shuyukh are not talking about organic chemistry and you know, architecture and chemical engineering. So a benefit-risk ratio is calculated by the public health professionals, the experts in the public health professionals. They have said, their very vast majority have said, it seems that the benefit-risk ratio is favorable. It seems that the risk of not taking the vaccine for humanity is much larger than the risk of taking the vaccine. But whenever you take any medical intervention, entails some risk. What is it in life that is risk-free completely? Where is it that you get benefit that is completely risk-free? Haven't you heard of the Prophet ﷺ say, al-kharaj bit-taman, which was made into a qaida fiqhiyya, a fiqhi principle? Kharaj bit-taman means what? Profit follows liability. Profit and liability come hand in hand. And then the fuqaha, you know, rephrased this into al-ghunm bil-ghurm, or some. It all has to do with, you know, the fact that profit and liability come hand in hand, because the life of this dunya is not like the Jannah. So there has to be some, it's mixed, and that's just the nature of the life of this dunya. However, the very vast majority of experts, as I said, they believe that the benefit outweighs the risk for the individuals and for the society at large.
And as a follow-up, Imam, Mashoud is asking, are the vaccines only effective for 6 months, and then we need to get vaccinated again?
Oh, no one knows yet for certain. This, you know, time will show, time will tell for how long these vaccines will be effective. But no one knows for certain. It is likely that, you know, it is very possible that this would be an annual thing like the flu. I don't think it will be every 6 months, but it is possible that it will be just like another annual thing like the flu.
That's very good. And then we do have Brother Arafat asking just a general question about, you know, do medically removed body parts, do they need to have a burial? or they can be disposed differently.
Okay. Okay, what is preferable is to bury the body parts that have been removed. Is it required? No, it's not wajib. It's not required in that sense. And if it will cost you a lot to do it, then just leave it for the hospital to dispose of it. Most of the hospitals do bury them, but they do bury them with other medical sort of whatever tissues and like, yeah.
But you can request it. You could request it and bury it.
You can request it. I'm just I'm saying that if it will be burdensome, if it will be a financial hardship for you, just leave it. Otherwise, what is preferable is to take it and bury it. Yes.
So we're coming down to about 2 more minutes, inshallah. So Ahmed, if you wanted to maybe review some of the initial vaccine information, and I don't see any more questions coming in. So, so تفضل.
Jazakallah khair, Brother Jaylani and Dr. Hatem. Thank you so much for this great educational session and community conversation around Ramadan and the COVID-19 vaccine. Inshallah, just to wrap up, for those who joined in maybe a little later in the conversation, we started off with a few vaccine opportunities within the community, and inshallah, let me just share my screen here and I can pull that up again. So inshallah, as you know, starting on Tuesday, March 30th, there was every Minnesotan age 16 plus has become eligible to receive their vaccine shot. And Wellshare, among other nonprofits and masajid and campaigns, have been working to provide vaccines for community members. One thing that we do know is that COVID has, disproportionately affected people of color, and simultaneously, people of color are those that are who there has been disproportionately receiving the vaccine. So not enough of people of color receiving the vaccine. So these are some upcoming vaccine opportunities. Wellshare has been working with Walmart to deliver the vaccine. Inshallah, there will be an event on April 24th to receive the Pfizer vaccine. Feel free to call our hotline if you want to get registered. And then, of course, the Muslim American Society of Minnesota, as you know, has been doing a Ramadan vaccine campaign with various masajid across the Twin Cities. It's been really great to see that effort blossom. So just a note here that they left that their current appointment slots are filled, but if you need an appointment before Ramadan, you can send a message to their Facebook page and they will follow up. Their staff will follow up with you and inshallah help you get signed up. So Jazakallah khair again, Brother Jaylani and Dr. Hatem al-Hajj. This has been a really great and beneficial session. And everyone who's been tuning in live, feel free to contact our organizations regarding the information we provided. And inshallah, we will be happy to help. So Jazakallah khair for your time, for your questions, for your engagement.